What if you could take that risk, make that change, reach that goal, live your best life? Welcome to another episode of the What If You Could podcast, where we get together with amazing experts and everyday people who share challenges, encourage healing, and explore the possibilities that life has to offer. I'm your host, Gary Scott, and I'm excited that you're along for the ride. Hey, everybody. Welcome to another episode of the What If You Could podcast. And today, my amazing guest, who I find fascinating, I haven't talked to her yet, is Dr. Leah Kaylor. Hello, Doctor.
Hi, thanks for having me.
Absolutely. Thank you for joining in. And you're a pitch hitter. You're kind of come in. I had an opening and I was like, hey, I know this is short notice, and you're very kind to come in, and that's a real trooper. So thank you for that.
My pleasure.
Yeah. So, guys, I'm just going to go ahead and give you a brief intro into the doctor, and then from there, we're going to hit the pond. So, we have Dr. Leah Kaylor is a licensed clinical and prescribing psychologist who has served as the FBI sleep expert for over 5 years. With a passion for optimizing human performance, she's on a mission to help others harness the transformative power of rest because better sleep shouldn't be top secret. Yuck, yuck, yuck. Dr. Lee shares practical science backed strategies on her YouTube channel and her upcoming book, The Sleep Advantage, which will be out and hit the shelves and be worldwide bestseller October 1st, 2025. So cool biz. So thank you again for joining me. Went
Thank you for
down the
putting that
rabbit
out into the
hole.
universe. Bestseller. I'm
Oh,
here for that.
Oh yeah. No, we're just nothing but good vibes here. Well, we just put that out and just yeah. So that's good.
I
And the
love it.
topic's fascinating, and let's face it, everyone has that challenge. But before we get cooking, I'm contractually obligated by myself to ask you the what if you could question. So, Doc, have you ever had a what if you could moment, a what if you could thought? Do you still have a what if you could that you'd like to share with everybody before we get going?
I mean, maybe this is cheesy, but what if I could reach as many people as possible and help them sleep better?
That is not cheesy. As a lifelong non-sleeper,
Oh,
um, and it's
is
a
that you?
family curse. No one in my family sleeps, except my wife, who basically just dies from 9 at night until 5 in the morning. We just let her. She just sleeps outside, hanging in a tree. She doesn't even sleep inside anymore. She's got such great sleep. But that's not hokey because eh, how many people suffer from sleep? You probably know a basic statistic.
Well, as I think about it, and let me just back up and try and like give a little intro into all of this. And one thing I want to mention is yes, I am the FBI sleep expert. However, everything I'm going to say here is my own thoughts, opinions, beliefs, biases, if you will, and don't represent anything having to do with the FBI. So I want to put that out there first. But
Thank you.
yes,
Even though they're listening, or is that the CIA? It might be the
yeah,
CIA. I don't
they all are. This microphone is tapped, maybe. We'll see. I don't know. So when I was training to become a psychologist, I knew I was going to do something in forensics. Like that was just where my career was going. That's where my interests were. And so on one of my very first days at the FBI, my supervisor at the time had asked me, Leah, what's going to be your thing? And I had thought to myself, well, given like the state of the world, I feel like we're working on it, we're getting better, but there's a lot of stigma around mental health. And then becoming part of a law enforcement agency, let alone the bureau, there's a ton of stigma, and a lot of people are afraid to step forward and admit that they've got something going on, let alone come and talk to a psychologist. So I said, well, how about this? How about sleep is going to be my thing, because I had just come from the VA. I was at the Memphis VA Medical Center in their sleep clinic, and I was really excited about all of my sleep skills. And so I thought, how about this? I will make sleep my thing because I don't care who you are, everybody sleeps. And everybody can relate to having a crappy night's sleep. Even if you're regularly a very good sleeper, you have chronic pain, or you eat too late at night, or you have a dog that wakes you up in the middle of the night to go to the bathroom. Everybody can relate to have a crappy night's sleep. And that was my thought was, I'm going to get my foot in the door with this. I'm going to talk to people. I'm going to let them know how they can sleep better. And then I will open the door for them to talk to me about additional mental health issues, trauma, whatever the case may be. So I have since made my name as the sleep expert, and you wouldn't believe how many people struggle with this, how many people, and that's part of the reason why I put together the YouTube channel, which is very slowly growing, but that's also why I wrote this book. It's because there's not enough Dr. Leah to go around.
Yeah.
Especially when I'm working one-on-one with people, like I needed to be able to find a way to scale it and to reach more people. And I had gone to a conference and I had someone come up to me from the audience and she was like, "Oh my gosh, this was so great. Thank you for your sleep talk. And my best friend isn't here and she's the one who really needs it." And I was like, "Oh, what a bummer. I'm sorry that she couldn't be here." And she says to me, "Well, do you have a website? Do you have some handouts? Do you have a book?" And like my eyes get real big. I'm like, "You would read a
Not
book?
yet.
You would read a book?" And I'm telling you, like, she planted that seed, and I went home and immediately just thought, "Okay, let's do this." I've been the sleep expert now for like 5, 6 years. I'm gonna write down everything that I know, and we're gonna and within 2 months it was written. It happened very quickly. And it was a lot of fun for me to just write it all down and to think about all the people that I've helped and all the different areas of sleep issues that I've addressed. And really that's what the book is meant to be, is kind of this troubleshooting guide for if you're having nightmares, here's what you do. If you can't fall asleep in the middle of the night, here's what you do. If you got restless leg, here's what you do.
But it goes way back though. I mean, you started working with people who, I mean, like you said, I mean, mental health, we still have so far to go with that. And
We do.
my son's in the Air Force and I know people in the military, you basically it's so taboo. I mean, we put these men and women
Mm-hmm.
out there just to get abused and then they can't come out and say, "Hey, I have problems." But I mean, you started way back. I mean, you started working with people who were suffering just
Yes.
because what they go through. And then did you hit on the sleep? Because you didn't start in sleep, right?
Well, I was training to become a psychologist, and I always knew that trauma was going to be my thing in some way, shape, or form, and it still is. And trauma and sleep go hand in hand. So, yeah, we're no stranger to it. But yes, I ended up at the Memphis VA Medical Center doing lots of different rotations. And you're exactly right. Whenever it comes to our folks in the military, we we just do the best that we possibly can, and it's certainly not meeting their needs as far as helping them come back from what it is that we have put them through. And I saw that firsthand at the VA because I was doing various different rotations, and some of it was trauma work and some of it was sleep work, and just thinking like, "Oh, this is so incredibly connected." And these folks, I don't know, I was at the VA in 2018, 2019, and I was just seeing a huge population of Vietnam veterans. And so for them to be, essentially like a grandfather type age to me at that time, I was just blown away at how much the trauma had stuck with them, and then how that was still impacting them years and years and years later. And just thinking, okay, we have to do something about this. This is just absolute torture that these folks didn't sign up for, well, well, well past their time of duty, their tour of duty.
Yeah. And then I found it fascinating because, so many people are, I mean, even like the number one podcast genre and the television shows is police and dramas and stuff like that, right? And, so everybody's into that. And
Hmm.
when I was, reading about all the stuff that you do and stuff like that and dealing with people, I mean, I do this because I love to meet interesting people like you, but I'm a real estate broker by trade, and
Okay.
many transactions have kept me up at night, right? Anything keeps
Mm.
you up at night, but many transactions. But then I was looking at some of the people that you help. It's like, holy cannoli. I mean, there's some of these things that people have to deal with in their jobs,
Hmm.
the children stuff and the murders and all these type of things, and then you've got to walk these people through that. That's pretty tough stuff.
It can be a heavy load to carry. It certainly can be because, again, I am just a magnet for trauma. And and that's great, you know, because I've been very well trained to do that. I'm certified in EMDR and in brain spotting. And so I have a lot of tools in my toolkit to be able to help these people, but it certainly does take a toll hearing these types of things day in and day out. And I certainly do think that since I'm early career, so for the past 5 or 6 years, I would say that I definitely do see the world through a different lens now that I've been exposed to so many different things and hearing the ins and outs of some pretty horrific things.
Yeah. I think
Yeah.
your second book should be called Trauma Magnet.
Maybe we'll
Yeah.
well, okay, book number 2 is already on the way. I've been writing it this
Okay.
morning, and it's now I'm targeting sleep for the military.
Awesome.
Yes.
Awesome. Well,
Yes.
they desperately need it. I mean, it's just like
Mhm.
just these guys, I mean, gals out there. I mean, catching sleep is like it's just unheard of. I mean, even if you're just a really seasoned person, like a family member of mine did like 6 tours in Iraq, 8 tours in Afghanistan, and I kept saying, Sarge, is it legal to send you that many times? I mean, that's craziness. So, I mean, these women and men, I mean, sleep is just it's just not in their vocabulary.
It's so incredibly challenging because I think that there's still a lot of stigma around sleep and thinking like, oh, well, sleep is for the weak. You don't actually need it. Like, we'll just give you like 2 or 3 hours and you'll be good to go. And that's not at all what the science tells us. But
Uh,
you know, I'm trying to take it from a different lens, and that's why we came up with the title "The Sleep Advantage." Is that if you actually allow your body to do what it is that it needs to do every night for that 7 to 9 hours approximately for the average adult, that you can push the needle in as far as resilience and human performance and clarity of thought. Like there's just so many things that sleep touches that if we allow our brain and body to do what it needs to do, some people would be absolutely blown away.
Yeah. I mean, and we have different sleep cycles, right? I mean, some people just really get into deep REMs from, 9 to 12, other people from 3 to 5. I unfortunately have my best sleep, which I don't like it, but my best sleep is like 5 a.m. to 6:30. And I'd like to be an early riser. I'd like to be up around 5:30, but it just seems like that's just my golden time. That's my 1 hour where I actually sleep hard. It's a weird thing. So, is that a
So
changeable thing? Is that an adaptable thing, or are we just born like that?
Well, so let me say this, between 6 or 5 and like 6:30 a.m., what you're talking about, that is a period that I certainly would not recommend that you cut out. So if you are the normal average healthy sleeper during the time in which we're getting closer and closer to your alarm clock going off, that's when you're in REM. And REM stands for rapid eye movement. And we know that someone is in REM whenever their eyelids are closed, but then their pupils are darting back and forth. That's how it was named. It's a very simple, straightforward name. And with that, there's so many incredible things that happen during REM. And people don't realize this. Like, oftentimes people think about sleep as like when you turn the light switch off to turn off the lights to go to bed. That I think people also think that you're turning off your brain, turning off your body, and it kind of just goes into like airplane
I
mode.
wish.
And it's not true at all. And so when you're in REM sleep, it's very, very important for emotion regulation. It's important for learning. It's important for taking the information that you have learned and integrating it into the neural networks that are already there. It's important for taking the information that you've learned all day and deciding, okay, is this need to be in short-term memory, long-term memory, trash? Like, where does this need to go? So there's so many different things that happen. And one incredible thing, if we were to put a cap with electrodes on someone who is in REM sleep, and then we are also going to put a cap with electrodes on someone who is awake and they're actively problem solving, the brain waves on these two people would look incredibly similar. So that is to show you how active the brain is at night and during REM. And so that is I have a chapter called Getting in Your Own Way because we do. Whenever we decide, oh, it's fine, I'll just stay up 1 hour later, like, come on, one more episode. We got to finish this. Or, you know, I'll just wake up an hour earlier and I'll meet that deadline or whatever. And so when we do that, we're getting in our own way of cutting out some really important pieces of sleep. So if you decide, okay, I'm just going to get up an hour earlier, well, you're cutting out a huge chunk of REM sleep, which we just talked about why that's important. But if you decide, oh, I'll just stay up a little bit later and I'm going to finish that book, I'm going to finish that chapter, whatever, that's cutting out deep sleep. And that's very different as well. So deep sleep is, I like to kind of think about it as putting your body on a charger. Like it's going to help restore your energy, but it's also really important for physical restoration because all day long we ask our body to do a lot and there we end up with a lot of micro damage and wear and tear. So if we allow our body to do what it is that it needs to do and move through these various different cycles, in deep sleep, we are going to get the physical restoration, especially if you're someone who's dealing with an injury, if you're trying to recover or rehab, that sleep is crucial. You can't be cutting that out. So we cycle through light, deep, and REM various different times throughout the night, and they all serve very, very important functions. And so without that very basic understanding, a lot of people are getting in their own way by cutting out sleep here or there, or just having poor sleep all night long and they don't know how to fix it.
Yeah. I want to kind of go back to that drama magnet thing a little bit because we
Okay.
all kind
I
of
said
just
trauma magnet, not drama magnet, but maybe
wait,
there's
wait.
that
Did
too.
you say drama or trauma?
Trauma with a T.
Yeah, that's what I said. Yeah,
Okay,
totally.
good.
I had a tongue surgery. They ripped out part of my tongue. I can't speak anymore. No, trauma magnet because we're
Yes.
like just people, especially now. I mean, like we just live in crazy town, right? So it's like we are trauma magnets. It's like even if there's nothing really wrong going on, we want to find it, right? We want to recharge our grief and we want to recharge our craziness and our anger and we just want to be lit up and we just love our trauma. So when because you're a psychiatrist, psychologist, besides a sleep expert, I mean, when you're dealing with these people, how do you get people to just drop the whole drama llama, trauma llama thing? I mean, how do you get people out of that?
Okay, let me clarify a few things. So I'm not a psychiatrist, but I can prescribe because I'm a prescribing psychologist. So I just want to put that out there.
Yeah.
But whenever it comes to that, one of the main things that I prescribe for people, I'm doing air quotes for those who can't see me, is stop watching the news. Stop.
Yes, good advice.
And it may seem really silly, but I've had clients before who come to me and they can't understand what's going on with them and why they're struggling and why they're feeling this and this. And so I'll ask them to do an audit first of how often are you interacting with the news, whether that's a podcast, having it on TV, reading an app, reading a newspaper. And people are blown away when they come back to me like a week later of, oh my gosh, I added up all the hours. And, when I'm riding the train to work, I'm listening to a news podcast. And then whenever I get to work, which our workplace, in my opinion, it is what it is because we have to have the news on to always know what's going on. So we have like four televisions, like all put together of all playing different news stations and they're everywhere. And it is what it is. I imagine that there are probably other offices that maybe do things like that too, to a different degree. But when we are at work, we are completely bombarded by the news. And I get it. Like that's part of being in the know and being aware and being able to respond to things in an appropriate manner. But what I tell people is if there's something that you need to know, you will know. You're probably there, just the average person's working 40 hours a week. And so those TVs are on everywhere you look. I mean, it's a wonder we don't even have TVs in the bathroom. Like, that's probably the next thing we're going to spend our budget on. But it really is, we are just so incredibly bombarded and the information is just coming in whether we like it or not. And so I tell people, when you go home, like cut that off. Like stop, don't sit down in front of the TV and watch the news while you have dinner. Go do things that are enjoyable for you. Go fill up your cup, whatever that is. If you like doing yoga or spending time with your family or being outdoors, like go do those things and cut off the news. And this is something, even though I definitely practice what it is that I preach, and people know that, my family knows that. So whenever I'm around and they have the news on, I'm like, okay, bye. Like, this is
I
not
just
what it
won't
is
get
that I
in
want
there,
to be
right?
bringing
But but
into my life.
but don't you see for a lot of people it's like a drug. I mean, they
It
literally if
is.
they don't get their anger fixed, if they don't get their I've got to, know what I'm supposed to be pissed off now fixed, it just it like affects them. Like if you were to take that away without saying, why don't you try to just like step away a little bit, wean your way off, right? But if
Yes.
you literally took that from them and shut that all off, some people would lose their minds.
And I think what you just said there is key about slowly weaning off. If this is such a problem for you and this is a quote unquote addiction of watching the news and being fired up about something, we need to slowly step away from that. Some people can go cold turkey, some people can't, and I trust that people know themselves hopefully good enough to be able to make that decision if they need to wean off or if they need to go cold turkey. But I would say give it a try because you don't really have very much to lose. Again, if there's something that you need to know, that information will find its way to you. But I think that
Yeah,
it's just
if a nuke hits DC, you'll know. All right, just let it go. We'll just let it go. You'll know, right?
someone
You'll
will tell
just know.
you
It's
it,
just like crazy.
yeah,
Do
and
the other thing, you got deep into what sleep does for us.
yeah.
Especially if you're a hard exerciser or if you just have a stressful job, fireman, police officer, whatever. I mean, you
Mhm.
really need to rebuild your body. And what I've found the last couple of years is um got sick in ways that I
Yep.
normally wouldn't get sick. Not
Mhm.
COVID sick. I never got COVID and stuff like that. But I mean, just dis-ease, right? Cancer, heart disease, stuff like that. That were just a
Yes.
really bizarre thing for me to get. And looking back, although I'm not a good sleeper historically, but I was even getting less and worse sleep during those periods where I got sick. And I mean, your body really cannot recover and fight disease and all this stuff if we're not sleeping.
You're exactly right. And just to kind of touch upon those points a little bit is one of the very important functions that happen at night is that our immune system is functioning. So at night it's going out and you can kind of think about it as like little detectives like going out and trying to find like invaders or bugs or things that are in our system that shouldn't be and fighting them off. It's also busy learning what infections or diseases or different things we've got going on so then it remembers it so the next time it comes back it can fight it even more effectively. So our immune system is very very busy and very active at night. So yes, it would make sense that if you're not sleeping well, then you are more likely to get sick and then it's going to be hard to fight that off because it's kind of like the chicken and the egg, right? Is when you're not sleeping your immune system is weaker. When you've got a weak immune system and you get sick, then you feel crappy and like you might be sleeping, but you're not getting great sleep because it's like maybe you're sniffly, coffee, running, like sore throat, like just shitty kind of sleep. So it's kind of like this cycle that keeps going. So what we need to be doing is preventative work and trying to get good sleep as much as we possibly can. And then you mentioned, there's so many physical conditions that can come along when we're not getting good sleep. And just to give listeners an idea, is a lot of people end up with high blood pressure. Well, here's what's happening is because at night when you're sleeping, this is the time for your body to rest. So your body should be resting. It should be coming down from that state of high stress and high anxiety. Your blood pressure should be dropping. Your blood vessels should be relaxing. They should all be getting a rest. Your heart should be getting a rest. But when we're not doing that and when we're constantly in the state of very high anxiety, and that's why I wrote this book for law enforcement and also the second one to come for military, is because they're constantly operating at this very, very high level of stress and anxiety. And then they end up with hypertension and they don't know why. Well, it's very much tied to not getting sleep because your body, your heart, your blood vessels are not getting that chance to rest and repair itself. And when we keep it at this very high level of functioning, something's got to give.
Yeah, and then we give them a prescription for that ailment, which screws up their sleep even more, and it's just a vicious cycle. It's just a horrible vicious cycle.
It's
What's
so challenging.
what do you say about napping? I mean,
Mm,
what does that screw up our nighttime sleep if old guys like me want to take a nap?
old guys like you. So, okay, I have a very specific view on naps. You will read lots of things on the internet from various different people and how they feel about naps. I'm going to tell you how I feel about naps and why I feel this way about naps. And then everyone can decide what it is that they're going to do. First and foremost, when it comes to safety, all bets are off. Like if you're behind the wheel and you're feeling sleepy, if you're like nodding off, if you're operating heavy machinery, if you've got a weapon, if you are in a situation where you're putting yourself or others at danger because you are so sleepy, stop. Stop what you're doing. Go rest. All bets are off. Now, when it is a lazy Sunday, maybe it's raining outside, you don't really have a whole lot to do. It feels good to maybe just get under the covers. That's when I don't endorse naps. And here's why. We're going to get sciencey again. We have this chemical in our body called adenosine. Adenosine
Wait,
builds
wait.
up
What's it called?
adenosine.
Adenosine. Okay.
Adenosine.
Okay.
So adenosine should build up all day long. So when we wake up after a full night's rest, adenosine should be low. It should build and build and build all day long. And that's also what we call our sleep pressure. So by the end of the day, that's what makes us feel sleepy. That's what makes us to one of the many things that helps make us feel like we want to yawn, like our eyes are getting tired. That's our signal to go to bed, that adenosine building up. Now, if we decide that in the middle of the day, the adenosine is building up, and then we decide we're going to go take a nap, the adenosine drops back down. So when we get to the time where we should be falling asleep, our adenosine isn't nearly as high, which means we don't feel as sleepy as we normally would. Our sleep pressure just isn't there. So that's why people often have a hard time falling asleep later that night, having maybe fragmented sleep, kind of having crappy sleep. It's because you got in your own way. You did it to yourself by not allowing that adenosine to build up as it should. Now, another way that I like to put this, and sometimes it resonates more with people, is I love Thanksgiving. I love eating a full Thanksgiving meal. I am a mental health professional and I don't endorse binging, but on Thanksgiving Day, I will I will engage in some binge behavior where I won't eat all day long until it's time for Thanksgiving dinner, and I want to go hard. Like I want to fill up my plate. Like this is the best meal of the year. I want to crush it. I want to leave room for dessert, like maybe in
I'm
seconds.
gonna go hard.
I'm gonna go
I'm
hard.
in there just
Double fisting the forks with the
stand
mashed
back.
potato.
Doc is gonna go hard on Thanksgiving, guys.
I am. So, okay, so I give this example as the Thanksgiving meal is like you have slept a full night. That's what we want to do. But how hungry are you going to be for Thanksgiving meal if you have snacked throughout the day, if you had lunch, if you had breakfast, if you had breakfast and lunch? And so the snacking is basically the napping. So if we've snacked, we're not going to be as hungry. We can't go as hard as we want to at Thanksgiving. And that's my point.
What a great analogy to
Thank you. I came up
explain.
with that on my own.
That was very good
Feel
because I
very
was going to
proud.
use a gas station analogy, but this is way better because
Wait, I want to hear
everybody gets it.
yours. Maybe I'll steal it.
Well, I was just thinking because you're talking about topping off the tank, right?
Hmm.
So if you're the type of person like me who likes if that gets to a half a tank of gas, I have to get gas, right?
Okay.
And then there's other people who are like, nah, man, I got a couple more miles, right? I'm on
Yeah.
fumes, which made me crazy. So if if you're always topping that off, then you're not gonna get, I don't know. Mine's kind of spun out of control. I'm not the doctor.
No, it's okay. I understand what you're talking about. Yeah.
But yeah,
You're
because you're saying it's got now if we nap, it
Mhm.
drains that back down, or maybe a battery is a better example. Maybe not gas is that good. I'm gonna leave that alone.
Okay. We'll go with
So
the Thanksgiving example.
yeah,
Yeah.
let's do Thanksgiving's way better. That's why you're the pro. So, what do you think about? You just made me think of something, which is
Okay.
gummies, sleep gummies that you see them everywhere. They're like Walgreens. I mean, you could just get them anywhere. What do you think about these things?
I have thoughts. And if you were in one of my lectures, I would tell you I have a slide for this because I have a slide for everything because I get a lot of the same questions.
I
So
feel hurt you didn't bring slides.
I
Now we have
could
to do this
have.
again. I
I'm
want slides.
we can. I'm
Next
sorry.
time we'll do slides.
Okay, we'll do slides next time. So I'm in a very unique position where I'm a psychologist, but I'm also a prescriber. So I can prescribe mental health medications, which includes sleep medications. So I'm in a kind of unique boat where I can do both of these things. I have yet to write a prescription for sleep medications because I don't really want to do that. Again, I have an entire chapter on there's no such thing as a magic pill because I think that's what a lot of people want. Like they don't want to do the work. They don't want to cut off caffeine. They don't want to cut out naps. They just want this magic pill. So this is very important for my law enforcement audience who's listening, for my military audience who's listening. Whenever it comes to sleep medications, And I have this all in the book, and this is just kind of a public service announcement. When you go to your local big box store and you walk down the aisles and there's like all the pills and the powders and the supplements and this and that, one thing that people don't realize is that the vast majority of the over-the-counter things are not regulated by the FDA, the Food and Drug Administration. So that means that they can have a lot of leadway on what it is that's written on the bottle and a lot of the claims. There's research out there, and this is research specific to melatonin, that when you look at what's actually on the bottle and then actually taking what's in the bottle and sending it away to a lab and seeing what's actually inside of it, that what is actually on the label and what's truly inside of that supplement are vastly different. And so sometimes we're seeing that the percentages of what's actually in it is much, much, much lower than what was
Are you saying that
advertised.
corporations might lie to us?
I mean, take it for what you will. But they're in that particular study that I'm
But
talking
that's
about.
100% true. Yeah, they can advertise anything they want because it doesn't have to be
Yes.
double, triple checked and all that stuff. So they can say whatever they want. But once you take a look at it, you go, dude, no, this is bullshit. Yeah.
Right. And they just have to have one very specific statement on the bottle. And as long as they have that,
Yeah.
that's it. And this particular study that I'm talking about, they found that when they did actually look at what was inside of it, it was, I think, 240% more in one of the particular gummies, because they took a whole sample. There was maybe 20 or 30 different sleep supplements that they were looking at, and one of them had 241% more than what was actually advertised on the label, which gets to be very dangerous again whenever we're thinking about a lot of parents giving like melatonin for their kids.
Yeah.
So it's just, I really want people to be informed consumers. And here's the thing, melatonin is very trendy right now. Gummies, they come in all different shapes and sizes and colors and flavors, and that's fun and exciting. However, your body already makes melatonin. That's
Yep.
what it does. It knows how to. So if we set up the right conditions, like getting early morning sunlight into our eyes just for a couple minutes, that's going to help. And it seems like it doesn't really make sense by why would you do that first thing in the morning? But that
Mhm.
helps us later make melatonin at night. Same thing, whenever we dim our lights in the environment as we're getting closer and closer to bedtime, that's also a signal for the brain, okay, it's time to make melatonin. So I think that there's a lot of people out there who just don't understand what melatonin is, how it works, but a lot of people are looking for this magic fix, this quick pill, this magic bullet, and it just really truly isn't there. So I would say for folks to be cognizant of what they're putting into their body, and this is the most important point, especially again for my law enforcement and military who have very particular strict regulations as to what it is they can ingest. There were some melatonin gummies that actually had CBD in it. So
Mhm.
that's very relevant for my population, that we can't be, that's a no-no.
That's what I was going to ask you is if you've touched on the cannabis. I talked to a cannabis doctor who prescribes just a ton of cannabis for sleep, and I don't know. I mean, I don't know. I mean, it's legal in a lot of places. It's not legal in a lot of places, but I know law enforcement just can't be chowing down on CBD gummies and pot gummies all day, right?
Exactly. And that's why we have to be very careful about what it is that's in it, and just knowing that maybe the bottle isn't always telling you the full story. And so just to be very careful about it. Again, like the slide that I don't have to show you here today, the foundation, it's like a pyramid. And so the bottom of the pyramid is behavioral modifications. Like, okay, we're going to have a wind down routine. We're going to start to dim the lights in the environment, things that I want you to change. Then we move up one more rung on the pyramid, and that's going to be behavioral modifications. And so, well, so we could switch them either or, but nonetheless, we're making changes to our environment. So maybe we're getting some blackout curtains, maybe we're getting a white noise machine or earplugs, or we're making sure that the room is cool enough for us to be able to sleep. So we need to set up the right conditions by behaving differently and by changing our environment. And after doing that for several weeks, if you're still struggling, then it's time for perhaps a sleep study. And then as we get to the tiny top of the pyramid, then maybe it's time for over the counter medications. And then maybe it's time for prescription medications. And there will be some people who it is a good fit to have prescription medications. And like you mentioned, there are some folks who I have consulted with who have some type of condition such as like severe chronic pain that cannabis, not that I have prescribed it, but they do get it from another source where that is the only thing that helps them sleep. So that's why it's part of the pyramid. It's that very small population who needs it. So I'm not saying that I'm against it, but I'm saying that we need to be trying other things before we try and get straight to the top of the pyramid so we can get this quick fix because it doesn't
Yeah.
exist.
Well, I love that because you're open to things that make sense. You're willing to look at different things on your pyramid that make sense to you without just right out the gate saying, I can't touch on that. I did watch a couple of your YouTubes and you
Oh,
touched on one. Oh yeah, yeah. No, I went through the whole rabbit hole of you. You've got all sorts of really interesting stuff. I wish there was even more we could touch on, but
thank
you
you.
did one on blue light glasses.
Yeah, that was
And
the newest
so
one.
I was at Walmart, and since I do look at my phone before I go to bed, but I make a habit of shutting it off and then reading afterwards to try to calm the mind just by reading
Right.
a book
Yes.
that I love to read. I used to never touch my phone and only read, and now I'm on my phone. So I saw them and I go, oh shit, 5.99. I'm going to give these a try. I Googled
There
it,
you go.
and a lot of studies said, yeah, they work great. And a lot of studies said, they're total bullshit. So you were on the side of, nah, don't waste your money.
And that, okay, so let me say this. There are blue light glasses out there. They're ugly, they're expensive, and those ones probably do work. And I have someone who helps me on YouTube and they make the thumbnails, and I wanted him to put those glasses on me, and he did, but they were not the ones at all that I wanted. I wanted like the really ugly, like they almost look like they're some type of like industrial type of glasses, but those ones are the legit ones where they are like red or amber tinted lenses. They're very big, they wrap around, and those would be excellent for people who are shift workers who are getting out of work, the sun is rising and they got to make their way home. So that is someone who blue light glasses would be great for because we want them to be able to go to sleep when they go home. So we're trying to block out as much light as we can on their commute to get back home because if that blue light is getting into their eyes, it's waking them up. So let me rewind a little bit and talk about why blue light is so important because it's really trendy right now, but I don't think people understand the science behind it. So when it comes to blue light is the same wavelength as sunlight. Well, if you were looking at the sun or you were outside and the sun was up, well, what do you think that your brain would think that it was supposed to do? Be awake, be
You're
alert.
awake, yeah. Yeah.
Yeah, because that's again our brains and our nervous system are still wired like our caveman ancestors, even though we have come so far. It's true. It's sad, but it's true. And
True.
that's,
Yeah.
we could talk about that in the trauma framework too. But just with regard to blue light is great during the daytime. Like that's why I recommend people to get outside within an hour of waking up and actually kind of look at the sun because that helps tell us it's time to be awake, it's time to be alert, it's time to start your day. And people have blue light filters and this and that. Blue light is fine all day long with your iPad, with your computer, with your phone. All those things are fine because it's helping to let your brain know it's time to be awake and alert. Where it becomes a problem is that 2 hours, 1 hour before bedtime, as we're getting closer and closer to the time that we would like to fall asleep, then, especially when we have our phone like right here, very close to our face and our eyeballs, that is whenever it becomes problematic because that blue light is coming into the eyes. And so the brain is like, wait, I thought we were getting ready for bed. Why is the sun out? I'm confused. Stop the melatonin, turn it off. And then people are, popping the melatonin gummies. So it's all over the place.
Yeah. Yeah.
It's all over and again, it's us getting in our own ways, and so if you understand the science behind it, that's what I'm trying to do is educate people. So if people are wearing blue light glasses, yes, if you have the ones that are very ugly and red and like orange tinted, then and those ones are supposed to be blocking out 90 to 100% of blue light. So if you were to have those ones, then yeah, you're probably doing yourself a favor. If you have the very cheapy clear lens ones that are looking pretty cute, yeah, those ones are probably not doing anything and you've wasted your money. I'm
Mine
sorry
did
to tell
not
you.
mine did not look cute, but they were
They weren't cute.
definitely cheap. But I mean, like you said, I think almost everything about us, our physiology, our nature, our fight and flight,
Hmm.
everything about us basically comes down to trying to get closer and closer to what we are supposed to be as humans, and we keep screwing that up with our diet, with our hour changes, with the overstimulation, with our
Yeah.
crappy food, with our crappy air, our crappy, and I just think the more we can get closer to our original what we were, everything will work better. I mean, a lot of things will work better.
You're exactly right. And that's a huge, it is what it is because whenever it comes to shift work, things happen. Like, obviously, whenever it comes to law enforcement, like, crime doesn't stop when the sun goes down. Like, obviously, we need people to be doing things around the clock. Same thing, like emergency room workers, like, accidents and stuff are going to happen where we need healthcare workers around the clock. And so it's unfortunate. And there are just professions that have to have shift work and have to be working throughout the night. But you're exactly right. Whenever we get into situations where people are sleeping when they should be awake and awake when they should be sleeping, like when everything is flip-flopped, one of the things that we know is that is a known carcinogen, meaning that it has been known to be associated with causing cancer. And the longer someone works shifts like that, the harder it is to bring their schedule back on track whenever they get onto regular day shift. And that is just so challenging. And I consult with a lot of people on how can we do better? How can we try and make this easier for our folks? And there are some ways that we can do that. But again, just recognizing that, yeah, these are things that we are not meant to do.
Yeah, that's just not how we're placed here. You've been so great with your time, and I know we're getting short here. There's something that's on your bio,
Oh,
which
okay.
I'd never heard of.
Okay.
I mean, there's a lot of stuff on here that I could just go down rabbit holes forever, but EMDR and brain spotting. I never heard of that, so I looked into it. The
Yeah.
EMDR is pretty fascinating.
EMDR and brain spotting are some of my favorite things. I love them. Like I said, I'm a trauma magnet, so I had to be very well prepared to handle it when it came in my door, and it does all the time. So EMDR, for those who are not familiar, stands for eye movement desensitization and reprocessing. And brain spotting, in my opinion, is its like younger, cooler cousin, like more trendy. So I love them both. I use them both, but I like brain spotting better, in my opinion. These techniques are both very well known for trauma and in the trauma literature. However, they can be used for lots of different things. So, say, for example, someone wants to do performance enhancement, or if they're getting really nervous because they're going to go take a polygraph or they're going to go take a fit test or they need to go qualify for firearms. These are things that we could still use to help a person feel to get to shake off some of that anxiety and to feel more confident. So there's a lot of different ways that we can use EMDR and brain spotting, but I think that they're most well known in the trauma literature, and that is primarily how I use them. But it's just the nature of my position and being a magnet.
Yeah. Well, that's awesome. Well, you've been amazing. And again, I want to respect your time. So I just have one last question.
Okay.
Now, I lied because, and you should have known I lied because you're a psychologist.
Well.
I lied and I said I had only one question, but I actually have two questions.
Okay.
First question I gave you. Second question is pretty simple, but it's basically if there was something that was important to Dr. Kaylor and that you wanted to leave our group, was someone a thought that you have, a saying you've heard, or just a thought that means something to you that you would like to leave us with, what would that thought be?
Okay. Should this thought be related to sleep or just any thought that I'm having?
Any thought that pops in your head. Just it's something that means something to you. I mean, you've dealt with a lot of really crazy stuff, a lot of trauma, a lot of pain, but a lot of good stuff. I mean, you've done a lot. You've been
Mhm.
exposed to a lot. And I'm sure in that I ask doctors a lot. I say, how do you leave it at the door, right? I mean, how do you not carry some of this madness with you? And I know you probably, that's a lot of your work is when you deal with these people and go, I know you just saw the craziest shit in the world, but you're just gonna have to let that go, right? So I guess if there's just something, that a belief that you have or a thought that you have that means something to you, you'd like to share.
So what I would say, maybe I'll just like zoom out, is take care of yourself.
Mm.
You only get one brain, you only get one body. No one is going to take better care of it than you. And when we are doing things like We've talked all about sleep, but when we're doing all kinds of different things where maybe we're putting like crappy fuel into our body, we're not exercising, we're, doing all kinds of things that maybe aren't great for our health, at a certain point, like you can't come back from that. Th- and I wish that I could, I feel like I'm going to butcher this saying, but like nothing, whenever there's something wrong with your health, that's the only thing that you can think about. So don't get there. Don't get there. Like, take good care of yourself, take good care of your physical health, take good care of your mental health, because nobody's going to do that except for you. And when you don't take care of it, then you end up in my office and I don't want to see you.
That was perfect. That was awesome. Because the truth is, unfortunately, majority of people do not think about their health until something happens, and then they
Exactly.
think about it. And
And
the
then that's
truth
all
of
you
the
can think
matter is,
about.
yeah, it should just be a daily conscious effort to take care of yourself mentally,
Hmm.
physically, emotionally, the whole kit and
Yeah.
caboodle. So, no, that was perfect. I love that, Doc. So, Dr. Leah Kaylor. I just
Like
completely
Taylor with
forgot
a K.
that. Like Taylor with a K. You've been awesome. So please tell us. I
Thank
want to
you.
hear your book's coming out in October.
Yeah.
Um, you've got a lot going on. So how do people reach you and find you so that you could fix everybody? Because there's about 4
Yeah.
billion people that need your help.
I know. And that's why I wrote the book. That's why I started the YouTube channel. So you can find me on YouTube at Dr. Leah Kaylor. And then if you only have the attention span of 20 seconds, I also have Dr. Leah Kaylor Shorts, which I give you very quick hits of sleep wisdom. I'm on LinkedIn at Dr. Leah Kaylor. And then something very, very new that I'm just starting to advertise. It may be up on my website now or tomorrow. But if people want to work with me, I am going to start offering sleep consultations for folks who just are struggling and need a very personalized, individualized, tailored approach. And that's what I will offer. So check out my website, drleahkaylor.com, and very soon those packages will be posted.
That's awesome. It's a great website, and I was
Thank
fascinated by
you.
all the forensic stuff that's on there that you offer for, to go and to do deep dives on stuff. And I was scrolling
Yes.
down, I'm like, Jesus, how many are there? Holy crap. And then it got to the last one was sexual stuff. I'm like, holy shit, I don't want her to find out about me.
That's what I used to do. I used to do sexually violent predator evaluations before all of this. So I have my hands in a lot of different things. I do. It's
You
crazy.
do. It's
Yeah.
crazy. But yeah, so you are awesome. And it is Kaylor. It's like Taylor with a K, but
Mm-hmm.
right. And Doctor, you've been amazing. So we're gonna post all your stuff on here. We're gonna put your
Perfect.
websites, where to find you, the LinkedIn, the YouTube, so that everyone could go get help. And I would love to have you back when your book
Yes.
breaks, and we'll just go deep dive on that book and get everybody on it. That'd be wonderful.
That sounds fantastic. Thank you for having me. This was a lot of fun.
Absolutely. Great time. All right, everybody. Thank you so much. We'll see you next time. See ya.
Bye. Thank you.
Bye. Thanks again for joining us on another episode of What If You Could podcast. Please subscribe, like, share, and give us any feedback. We'd love to hear it. And remember, if you can dream it, you can do it. See you next time.